It's an exciting time. I think we've realized at this point that femtosecond cataract surgery is a reality that can really enhance the delivery of good eye care that we provide our patients. We're taking an excellent procedure, cataract surgery, phacoemulsification, and really taking it to new levels, levels that we haven't thought of before, and really made it available to every physician. So we are now taking good surgeons and making them great by taking some of the manual parts of the surgery and putting them into the hands of our excellent technology. So when we were presented with this technology in our group, which is 11 ophthalmologists and 7 optometrists, and our cataract surgeons who make up 5 of that group, we look at this technology and we studied it. And like the good students we've always been, we pulled out all the research articles and we talked amongst ourselves. And like ophthalmologists, we argued. Some felt it was not necessary. And as this technology grew up and as we realized that we had a responsibility to our patients in a health system, we felt that not just for ourselves but for our group, we needed to bring this technology. So we felt, after looking at the data and talking to physicians and flying all over the world to look at these systems and look at the results, that femtosecond cataract surgery was the right thing. Working in a Catholic hospital, which has a mission statement that says providing the best care with a special concern to the poor, the model of how do we provide this became challenging. This is not an inexpensive technology and it has unique financial implications. But we knew that this was the right thing to do. So when we went to our hospital system, we felt the only way we could be involved in this technology and participate and provide this to our patients was if we made the step of treating every patient. So as of March 4th of this year, when our 2 catalysts arrived, every patient who had a cataract for surgery, visually significant or refractive lens exchange, patients came in, were given the appointment for cataract surgery, showed up to the Mercy Eye and Ear, and they underwent femtosecond cataract surgery. If they wanted to have management of astigmatism or presbyopia through LRIs, torics, or multifocals, then they certainly had the opportunity to do this and they paid for that. But the actual evacuation of the cataract, meaning the incisions, meaning the capsulorhexis, and the nuclear softening, which was done followed by the evacuation of the nucleus and implantation, was part of the covered experience that Medicare or their insurance covered. We felt this was very important for our patients, and we now have our first 6 weeks data of over 300 patients. We're very proud of it. It's something that when we look at each one of our patients and we realize they didn't wake up and say, gee, I'd like to get rid of my cataract. They said, my vision is getting worse. What do I do? We're now able to say, hey, we feel this is the right thing to do to take out your cataract. And the best way to do that is to use the femtosecond cataract surgery, the Catalys system, to help remove that cataract. And everyone will get this done. There isn't going to be a distinction if you can afford it or not. We felt very much that we were providing the best care to all our patients, and we were doing the Mercy mission of providing this care with a special concern to the poor. And really this is something that required a major change in the way we worked as a system. We had all our physicians really strip down the cataract procedure. Myself, I had to give up sub-tenons blocks for most of my patients because it was time consuming and it cost extra monies. And you know what? I was very scared for the first couple of patients. But this is a much more simple procedure, and my fear of the patient moving during the rhexis, since the rhexis takes 2 seconds, really I didn't have a fear anymore. So going to topical, which I dreaded the night before surgery the first day, I look forward to now. It's been very easy for me. Our other surgeons, we all put them together and we said we can't have 3 different IOLs just because we can have them. We have to standardize the procedure, streamline it, so use one form of viscoelastic, one form of an IOL type. And then we got to go to the vendors and said, hey, for the volume of cataract surgery we do, which averages about 3,500 cases a year, we are going to do everybody. And what is it worth to you as our vendor to participate in this dream of providing femtosecond cataract surgery to everyone? And we really found out that some of our vendors were very much excited to participate in this, and they've opened up opportunities for us not just in the ability to cut the cost of the procedure, but also open up opportunities in research to look at new intraocular lens designs, to provide opportunity for this femtosecond laser. It's a great tool. We look forward to working with OptiMedica and other groups that wish to join us in participating in improving cataract surgery. It's something that you wish once in your life you could participate in a new wave. And to be able to offer this to every patient, I know I sleep well the night before, I know my surgeons sleep well, I know my coworkers, my nurses, my techs, my surgical counselors all realize they are offering the best to their patient. And that morale boost that these lasers have given us is an incredible thing. It is, I can't measure it, I can just tell you that it really makes us feel very good in Springfield.